السلام عليكم.
وعليكم السلام ورحمة الله.
عليكم السلام ورحمة الله.
عليكم السلام سلام.
Okay, guys, today, inshallah, we will finish procedural skills, supervision, and teaching. So we will continue next session, ECG teaching and ABG. We have for practice today Fatima Safana and Fatima Resenia, Marwan Somodo, Hadil, and Hasiba. Okay. So again, the general approach of teaching, any teaching, whatever procedure or ECG or ABG, you will introduce yourself. Good morning, I'm blah blah. May I know your name and grade? Nice to meet you, Robert. I believe you have something to discuss with me regarding blah blah blah, and mention the topic. Then say, nice topic. Ask 2 questions. The first one, how much do you know so far about this topic? And stop. Then next question, anything specific you want to know? Then you will set learning objectives. You can say, today I will set learning objectives for you. I will teach you, blah, 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 blah. Mention the name of the topic. I will teach you. If procedure, you will divide the station into 3 parts. But if ECG or ABG, it's a different, okay? So I will teach you indication, contraindication, complication, how to prevent and treat complication, preparation, procedure, post-procedure, management, advice, follow-up, documentation. And ask the actor, is that okay? Then you can start the teaching. Okay, Fatima, Safan?
Yes, sir.
Okay, are you happy to practice this station?
Okay.
So here regarding hematoma block, it means you will do inside the fracture bone in the dorsal surface. Okay, you have 30 seconds and 6 minutes, okay?
Shall I start, sir?
Okay, you can start.
Hello, I'm Dr. Safana ID Registrar. May I know your name and level, please? Nice to meet you. I guess you have something to discuss with me today. Yeah, hematoma block is a great important topic in ED practice. So how far do you know about this hematoma block? Okay, is there any specific area you want to discuss? Okay, so let me take learning objectives. First, I will talk about indication, contraindication, complication, and how to prevent them, and preparation and technique, and post-procedure assessment. And at the end of the session, I will give you learning website and videos to learn more, and you can ask me any question anytime. Okay, so now I'll talk about the indication. The hematoma block is done in where there's a fracture and which is used to reduce the fracture site. It will numb the area, which will help you to reduce the fracture. So mostly today I will talk about the fractures in the forearm, Colles fractures. So what are the contraindications? Contraindications are like if the patient is having allergy to local anesthesia, or if the patient is having any patient refusal for this procedure, we can not do the block. Then what are the complications? Yeah, mostly patient we can inject this local anesthesia into the system, or the patient get local anesthesia toxicity. So how can we prevent them? So prevent, we have to do assess the patient, and we can use the ultrasound guided, and we have to be ready if there is any local anesthesia toxicity. Like how we can take the patient to the resuscitation area, we can monitor, and we can give oxygen, give IV fluid, and if the patient collapse, we can give intralytic. Okay, now I will talk about how to do the procedure. First, we have to wash our hands and wear PPE, and we have to be very sterile. And after that, we have to gather the equipment. So we need injection syringe for injection, and ultrasound. Also lidocaine, that is 3 milligrams per kg, and povidone iodine for cleaning, and sterile drapes and gauze. Okay, so how do we do? So first we have to locate the area. So first we have to palpate the fracture both ends. Okay, so we have to so in the between that we will find the hematoma. Okay, so first locate the area, and we will clean the area with povidone iodine, and after that we can drape the area. After that, if you want, we can locate the hematoma with the ultrasound guidance, and we can locate the place. After that, we can inject small amount of around 2 ml of local anesthesia above the skin to anesthetize the skin, and after that, we can insert the needle inside the bone in the located area between the fracture site, and after that, and we can guide with the ultrasound scan also. So then after that, we will aspirate and see whether blood is coming. So if the blood is coming, we can ensure that there is a needle is in the hematoma. So we can inject 10 cc of local anesthesia lidocaine into the hematoma. After that, we can, while doing this, we have to observe the patient for any local anesthesia toxicity, and we can do the reduction of the fracture. So post procedure, how do we manage? Post procedure, we can monitor the patient for 4 hours before any local anesthesia toxicity. If not, then we can follow the orthopedic management, like we can give a referral to the fracture clinic for post assessment. Also, after the procedure, there is a application of the back slap. So we will give referral to the fracture clinic for review in 2 weeks time. Okay. So do we have any questions? Do you follow me up to now? Okay, let me repeat my procedure today's session. So I have talked about the indications, contraindications, complications, and what are the things we need, and how do we prepare the patient, and how we give the local anesthesia to the hematoma. So can you tell me the site of the hematoma injection? Yeah, first we have to palpate the 2 bones, and we will inject first we anesthetize the skin, and after that we inject it, and we will aspirate and see whether there is any blood, and after that we will inject the local anesthesia. Okay, so do you understand so far? Do you have any questions? Okay.
Okay, excellent, Fatima. You still have 30 seconds, and in the exam, you will find further 2 minutes. So when you recap, try to be slow and focus on the most important point. For example, the procedure, or you choose any point to focus on, and try to be slower. Okay.
Okay.
Well done. So here you have to follow the general approach, how to prevent the complication, of course, for local anesthetic toxicity, adequate calculation of doses, and dimension the dose. Lidocaine will be 3 milligram per kilogram, and also reduce doses in old ages or extremes of ages, so old, very old or very young. Regular aspiration. Here you are injecting in the dorsum. So in the dorsum, don't worry, you will not find artery or vein. Okay, so arteries or veins, it will be in the palmar side here. So you are in the dorsal side. Okay. Well done. I think you covered almost all the points. So here, what you will do, you will feel the parts of the fractured bone, the proximal end and the distal end, and you will inject local anesthesia superficial first to numb the skin and the subcutaneous tissue, and then you will insert the needle between the two parts of the fractured bone. You will aspirate, so you will find the blood coming out. It means the needle is in the hematoma. Then you will inject the local anesthesia. After that, you will check numbness. If the patient has numbness, so you can do reduction. Okay, well done. So I will give you 9 out of 10. Excellent.
Okay.
Fatima Resenia?
Yes, sir.
Okay. Digital nerve block. Digital here, we did not say finger, we did not say toes. No, digital means whatever in upper limb or lower limb, right?
Okay, sir.
Okay, so you have two nerves up and two nerves down, or you can say dorsal and two palmar, right? Okay,
Okay.
you have 30 seconds and 6 minutes.
Can I start, sir?
You can start.
Hi, I'm Dr. Fatima, ED Registrar. May I know your name and age, please? May I know your name and level, please? Nice to meet you. I believe that you are here to discuss about digital nerve block. Is that right? It's an interesting topic in the ER setting. How much do you know about the digital nerve block? Is there anything specifically you know? You want to know about the digital nerve block? Okay, so I will make it easy for you by dividing, setting some objectives and teach you. At the end, I will give you some link and videos to update your knowledge, and the indication, contraindication, complication, and how to prevent the complication of the digital nerve block, and how to prepare the patient, and how to do the procedure and the post-procedure management. I will teach you. Okay, can you understand? Are you with me? Okay, so the indication is this can be done in either hand or foot for any finger or toes, but I will explain in the hand. The indication is to numb the area for a surgical procedure, for abscess drainage or suturing, or to do foreign body exploration. So contraindications will be for as for any nerve block, if there's allergy to local injection, or is there any infection at the site of injection, or if the patient is undergoing general anesthesia, it will be a relative contraindication. Okay, so complication will be infection at the site of injection, and bleeding due to intravascular damage, or local anesthetic toxicity. So this can be is prevented by complication can be prevented by regular aspiration of while injecting and measuring the dose for the weight, calculated dose, and using less dose in extreme ages, and in digit especially we have to use plain lignocaine and avoid adrenaline because it will cause digital ischemia. And to prevent infection, we have to use a sterile procedure. Okay, so can you understand? Okay, so if in case the other major serious, rare but serious complication is the local anesthetic toxicity, which can be which is serious. So in that case, we have to move the patient to resuscitation area, give oxygen, IV fluid, and then give intralipid in case of local anesthetic toxicity. Okay, so during the procedure, we have to first get the consent of the patient and confirm the site where to inject, and then we have to prepare the equipment, needle, syringe with lignocaine, sterile drapes, and disinfectant solutions. Once you get the consent, you have to clean the area, you have to wear gloves, and there are in the anatomy, each digit has 4 nerve supply, 2 from the dorsum, 2 from the palm aspects, that is medial and lateral, either side. So you have to block all 4 nerves. Our injection site will be dorsal aspect. So you take 3 milligram per kg lignocaine dose with fine needle. You have to enter in between 2 digits distal to the MCP joint and enter from the dorsal aspects. First you give superficially 2 to 3 ml, and then you enter slowly to the palmar surface, but do not penetrate the palmar surface. At deep, you have to inject another 2 to 3 ml of lignocaine at medial side, and then slowly withdraw. And you have to inject the other lateral side, superficially 2 to 3 ml, and you have to inject deeply as you did in the medial side. So once you give the adequate doses, you ask the patient, wait for sometimes 5 to 10 minutes, and ask the patient whether he's feeling numb, and check with the forceps. And once it is adequately numbed, you have to do the procedure. Can you understand? Once all the procedures done, you have to discard all the sharps, and then you have to document in the and make sure patient is comfortable, pain-free, and plan for discharge. Can you understand, or do you want to know something else? Okay, so I will recap now. This is digital nerve block. You have to block 4 nerves, and the dose you should take is 3 milligram per kg lignocaine. And you have to, once you mainly you have to make sure there's no contraindication. And once you get the consent, you have to reach from the dorsal aspects of the palm. You have to inject from medial and lateral, both side, 2 site injection, 4 nerves block. And once you blocked everything, you make sure the patient is numb, and then you have to undergo the procedure. And the most importantly, use plain lignocaine. Okay. Is the
Okay, excellent. Your time done. Okay, well done.
Thanks.
Okay, excellent. I think you covered almost all the points. Indication, contraindication, complication, how to prevent, and also you did well regarding explaining the procedure itself and the post-procedure. You tried to recap. Well done. So I will give you 10 out of 10. Excellent. Marwan,
Thank you.
Yes, sir.
next. Sir.
Assalamu alaikum.
Okay. Marwan, you will do fascia iliaca nerve block, and Fatima, sorry, Samodo.
Yes, sir.
Hello. Yes, sir.
Somodo?
Yes, sir.
Okay, you will do
Hello.
yes, yes. You will do femoral nerve block, okay?
Okay.
So the same fascia iliaca nerve block and femoral nerve block the same, okay? So first I will show you. So here fascia iliaca, you will block 3 nerves, right?
Yes, sir.
But femoral, you will block only 1 nerve. So for Marwan, you will do fascia iliaca nerve
Yes,
block.
sir.
For Samodo, femoral nerve block. So the difference only the landmarks, okay? So for Marwan, what is your landmark for fascia iliaca?
For fascia iliaca, I have to imagine a line between the anterior iliac spine and pubic tubercle, and I will divide in 3 parts. And I will there is a junction between the lateral one half and middle to third. 1 centimeter below that, there is a inguinal ligament, and that is our landmark. Is fascia iliaca block. We have to do this.
Okay, and the Samodo, what is your landmark?
For femoral nerve, between line between anterior superior iliac spine and pubic tubercle, 2 centimeters lateral to the midpoint of that line is the femoral nerve.
So you have vein, artery, nerve, okay? So you will feel the maximal pulsation of the femoral artery. You will insert 1 or 2 centimeter lateral to the artery. Below the inguinal ligament, 1 or 2 centimeter. Clear?
Okay.
Vein. So vein, artery, nerve. Okay. So here, regarding the injection, you have 3 nerves for fascia iliaca nerve block. What are the nerves, Marwan?
Nerve is one is femoral nerve, lateral cutaneous nerve of thigh, and obturator nerve.
Marwan, your voice not clear. Maybe the mic. You are muted, Marwan.
Sir, is it clear now?
Yes, clear.
Okay, sir.
So how many?
Sir, there is a 3 nerves. One is femoral nerve, lateral cutaneous nerve of thigh, and obturator nerve.
Yes, and for Samodo, only femoral nerve. Clear?
Okay.
So the same approach. Marwan and Samodo, I'm talking about fascia iliaca nerve block and femoral nerve block. Same approach. So you have skin, you have fascia lata, and fascia iliaca. Okay. What is your target? Which muscle?
Iliacus muscle.
Iliacus muscle or iliopsoas muscle? Okay. You have
Iliopsoas.
yes.
Yeah.
You have question in final SPA. They will ask you what is the muscle. So remember that if they give you option iliopsoas muscle, you can choose. If they give you option iliacus muscle, you can choose. Anyway, so you will be above the iliacus muscle, whatever this one or this one. Clear? Okay. So you will penetrate the skin, the subcutaneous tissue, fascia lata, and
Fascia iliaca.
fascia iliaca. Okay. Again, you will penetrate skin, this one, subcutaneous tissue, this one, then to fascia lata, and
Fascia iliaca.
fascia iliaca. Okay. So you will inject first to numb the superficial area. So you will inject lidocaine because lidocaine for superficial, right? But deep,
Yes, sir.
what is the local anesthesia for deep?
BPVCAN.
Yes. So first you will numb the superficial area, skin and subcutaneous tissue by lidocaine because lidocaine it's only like 1 hour or 2 hour maximum. But bupivacaine 6 to 12 hours. So better. Okay. Here regarding the skin, you will inject 3 to 5 ml. After that, you will inject deep by bupivacaine. For Marwan fascia iliaca, it will be lateral. For Somodo, it will be medial. Clear?
Yes, sir.
For Marwan fascia iliaca, it will be 40 ml. 40 ml. It means 2 syringes. The needle will be in place. Don't remove the needle. So you will inject 20 ml syringe slowly over 5 minutes. And then you will remove the syringe and put another syringe 20 ml, but keep the needle. You will inject another 20 ml. Okay. For Somodo, you will inject 20 ml only, one time. Easy, Somodo?
Okay.
I think now the same approach, but some modifications. Okay. Okay. Marwan, you have 30 seconds and 6 minutes.
Okay, sir. So shall I start?
Okay, you can start.
Okay, good afternoon. I'm Dr. Marwan. May I know your name and grade, please? All right, nice to meet you. I believe that you have something to discuss with me regarding fascia iliaca block. This is a very good practical skills in emergency. So could you please, how much do you know so far about these topics? Okay, so anything specific thing you want to know? All right, today I will set you learning objective. I will teach you regarding indication, contraindication, complication, and how to prevent and treat the complication of fascia iliaca block, and how to prepare the patient and how to proceed the fascia iliaca block, and then post-procedure management and documentation. First, we come with advantage of fascia iliaca block. You can block 3 nerves by doing fascia iliaca block. One is femoral nerve, second is and obturator nerve. What are the complications of fascia iliaca block? Especially to numb the anterior compartment of the thigh for the pre-operation analgesia of a patient with fractured neck of the femur and femoral shaft. And you can also do if there is any wound explanation in the anterior thigh. There are some contraindication of fascia iliaca block if patient is refused to do the procedure, if there is any distorted anatomy, if there is any infection in the injection site like cellulitis, and if there is any allergy to local anesthesia. There are some complications of fascia iliaca block like hematoma, failure, and finally local anesthetic toxicity. So how you prevent and treat the complication? So basically, if the patient you can prevent the complication by giving adequate and accurate calculation of the dose, like Hello, sir.
Yes, Marwan, I think there is a signal problem. Okay,
Yes, sir.
can you start again? Sorry?
From the beginning, sir?
Yes.
Okay, sir. Okay, good morning. Good afternoon. I'm Dr. Marwan. May I know your name and grade, please? All right, nice to meet you. I believe that you have something discussed with me regarding fascia iliaca block. Is it right? All right. So how much do you know so far about these topics? Okay, anything specific do you want to know? Okay, today I will set you learning objective. I will teach you regarding indication, contraindication, complication, and how to prevent and treat complication. And I will tell you regarding the preparation of the patient and doctor and how to proceed. And there are some post-procedure management and post-procedure follow-up and advice. So let's start with the indication of the advantage of the fascia iliaca block. So by doing a fascia iliaca block, you can block the femoral nerve, lateral cutaneous nerve of thigh, and obturator nerve. Well, and there are some indication where you do fascia iliaca block to numb the anterior compartment of the thigh, especially preoperative analgesia for patient with neck of the femur fracture and femoral shaft fracture. And it can use also in any own exploration in the anterior thigh. All right, I understand what I'm saying. Okay, so there are some contraindication if patient refuse to do the procedure, if there's any distorted anatomy or any infection like cellulitis over the injection site, or any allergy to the local anesthesia. There are also some complication like infection, bleeding, hematoma, and failure of the procedure, vascular infiltration, nerve injury, and local anesthesia toxicity. So now I'm telling you about the how to prevent and treat the complication. So you can prevent the complication by accurate and adequate calculation of the dose. Like in this case, we can use lidocaine 3 milligram per kilogram and bupivacaine 2 milligram per kilogram. And you can also reduce the dose in extreme of ages, and the injection should be slow and regular aspiration. And you have to prepare interlipid if there is a any signs of local anesthetic and local anesthetic toxicity. And you also can use ultrasound guidance and nerve stimulator. So how can you treat the complication? If patient develop a local anesthetic toxicity, you have to move the patient to monitored area and connect with the monitor, and you have to give oxygen and fluid as well. In case of any collapse patient, so you have to administer immediately interlipids. All right, I understand what I'm saying. All right, so how to prepare yourself? You have to wash your hand and wear sterile gloves, and you have to take consent from the patient, and you have to make the position of the patient in supine position. And before the procedure, you have to prepare the equipments like draping, provision iodine, local anesthetic agent, especially lidocaine 3 milligram per kilogram and bupivacaine 2 milligram per kilogram. And you have to keep 3 syringes, one for lidocaine and 2 syringes 20 ml, 20 ml for bupivacaine, another 20 ml for bupivacaine. And you have to keep the interlipid if there is any chance of local anesthetic toxicity. And if in your hospital there is any available of ultrasound or nerve stimulator, that will be great. Okay, so we have to before the procedure, we have to make a landmark. You have to clean the area with the povidone iodine or normal saline, and then drape the area with